A common surgery that I perform is eyelid surgery, and that takes up about 40% of the surgery volume that I do. There are a number of types of eyelid surgery that we perform. The most common is probably for droopy eyelids. Sometimes that's cosmetic. Patients just don't like the redundant skin or wrinkles around their eyelids. And sometimes that can be because the patient doesn't see well and the lids hang down in the way. There are a couple kinds of droopy eyelids, and it's important to be evaluated and determine what the cause is. Often it is just aging. The tissues of the face get a little bit less tensile or more lax as the patient ages, and wrinkles and creases form, and it seems like there's more redundant skin. As the brows sag down, that can exaggerate the amount of skin that hangs over the eyelids. Ptosis is the drooping of the eyelid margin itself. So where the eyelash line meets the edge of the eye is called the eyelid margin, and when that droops, that's called ptosis. That's different than dermatochalasis. Dermatochalasis is extra redundant eyelid skin. It's that sort of curtain of skin that hangs over the eye and over the pupil and often can push down on the lash line and even hang over the lash line. Ptosis is repaired by actually tightening the muscle that lifts the lid up and down, sometimes called a levator advancement or ptosis repair. And redundant eyelid skin, dermatochalasis, is actually repaired by performing a blepharoplasty. Blepharoplasty can be done on the upper lids or the lower lids, and there are several different approaches for that. A lot of times when we do a blepharoplasty, we'll take some of that fat that bulges out behind the eyelid skin. Again, more common in the lowers, but usually there's fat prolapsing in the upper eyelids as well. So that can be done for cosmetic purposes or to improve the patient's vision. If a patient complains that their eyelids are in the way of their vision, then we have to do some testing to see if it really is hindering their vision. So we'll do field testing on the patient, and we'll do that with their eyelids elevated, and then we'll allow their eyelids to hang down. And if they get better vision with their eyelids up, then sometimes that is a procedure that's covered to improve their vision. If that doesn't seem to make a difference, cosmetic eyelid surgery is always an option.